Hi, my name is Enema and together with my partner.
And my name is Nur Alana Bilamita Usman.
And today we are going to do a role play in Barium Enema. So in this procedure, it is to demonstrate if there is any obstruction, including aliens, volumulus, and intersection.
And for this procedure, we use double contrast media, which to demonstrate the verticalities, polyps, and also mucosal changes. So basically, for this role play, we're going to show you two views, which is right anterior oblique and left anterior oblique. So for the patient preparation, first of all, the patients must follow a special diet the day before the examination. This means that the patient may be asked not to eat and only drink a clear liquid for 1 to 3 days before the examinations. And also, patient must fast after the midnight. This means that patient may be asked not to eat or drink after the midnight the day before the examinations. And also, patient advised to take a laxative the night before the examination to clear the colons, and also inform the doctor about their medical history, if there is any chance of pregnancy or any allergic to foods or contrast media, and also if there has undergone any recent colon related tests, and also check for the AFGR, estimated glomerular filtration rates, to check for the creatinine levels, glucose, and also Bunsen levels.
So the equipment for this Barium Enema procedure, we use Foley catheter, gauze, a pump, and contrast media. Barium sulfate is the common type of contrast media for this Barium Enema procedure. The standard one is 500 ml and dilute with tap water. We also use Enema bed. This Enema bed with a premature amount of barium sulfate. Once mixed, it will travel down to its own connective tube, and the flow will be controlled by a plastic stopcock. An Enema tip is placed at the end of the tubing and is inserted into the patient rectum. This Enema bed can be disposed after one single use after the examination has been completed. Okay, first thing first, before starting the procedure, must wear the glove at both hands, and then ask the patient to turn and roll into the left side facing away. And then put the patient right leg over the left leg. And then get ready with the equipment. This is lubricated gel to apply at the enema tip to smooth the incision of the enema tip while we put into the patient rectum. So, enema tip is applied with lubricated gel. Ask the patient to breathe in and breathe out slowly. So, in counts 1 to 3, insert the enema tip. And inflate the balloon. So, while in this position, ask the patient whether she or he is okay or not. Ask the patient if she feels any cramping. Ask her to hold if she feels need to go to restroom. So when the tip is removed, the patient may feel the barium start to come out. So just try to hold as much as the patient can. So after everything is completed, remove everything and dispose them.
Okay, so first of all, we need to set up our control panel. So first, choose the body part, which is the abdomen part, and we choose the large intestine, which is barium enema, and then we choose our positioning, which is RAO position. And for the exposure factor, we're going to use is 19 kVp, and also 4 mAs for this procedure. So before the procedure, first of all, we need to make sure the room is clean and tidy. And for this procedure, I'm going to use a cassette size of 35 by 43 centimeter. And I'm going to set the cassettes to prepare for the examinations. And don't forget to put the marker also on the top of the cassette without overlap with the structure of interest. Okay, Mr. Instructor. Okay, can you give me your name? My name is Mr. Instructor. Okay, when is your first day of your last period? I'm currently on my period. Okay, are you fasting right now? Yes. Okay. So I'm going to ask you to change your clothes to hospital gown and please remove any objects on your body. Okay. We're going to use corner shield to protect the patients from radiation. For the RAO positioning, the patient needs to lie down on the table and we need to change the position of the patient to semi-prone position rotated into 35 and 45 degree and make sure the patient is comfortable. Place the left arm up on pillow with right arm down behind the patient and we're going to use a sponge to help the patient in his intro oblique positions. And don't forget to flex the left knee of the patient to make sure the patient is in true oblique positions. For the centering parts, first direct the center perpendicular to IR to a point about 1 inch of the left of the MSP and center the centering and image receptor to level of iliac crest. As for the collimations, we need to include all regions of interest and collimate to outer margins of the IR. And don't forget for the SIT, we need to use a minimum of 100 centimeter. And as for the respirations of patients, suspend respiration and expose on expiration.
Here, figure 1 shows image criteria for the RAO position. In this position, ensure that the right coliflexure, sigmoid colon and also the ascending are seen as open without any significant superimposition. And then ensure that the entire large of intestine is included in the radiograph with possible exception of colic flexure, which is very best to demonstrate in LAO position. And the last one is ensure that the rectal ampulla is included in the margin of the radiograph, because we need to give the optimal exposure in order to visualize the contrast field the large intestine without any significant overexposure. Here, figure 1 shows LAO position. So the image criteria for this position, the left colic flexure should be seen as open without any significant superimposition. And then, the descending colon should be well demonstrated with the large intestine should be included in the radiograph. We must give an optimal exposure in order to visualize the contrast with the large intestine without any significant overexposure at any portion.
So for the procedure post-care, usually after the examinations, the barium will be removed from your colon through enema tube. After the tube has been removed, the patient can use a bathroom or can use a bedpan to expel the additional barium and air. For a few days after the examinations, the patient might have a wet stools as the body will naturally remove the additional or remaining bariums from your colons. And barium may cause constipation, so patient might be advised to take extra fluids to reduce the risk of constipations, and also if needed they will also advise to take a laxative. And if the patients have a problem with their bowel movement and also if their stool does not return to their original color for a few days after the examinations, the patient might need to immediately check with their doctor. And lastly, for the risks and complications, usually barium enema is a safe procedure with a minimal risk. Potential risks and complications including severe constipation and obstructions, inflamed area in colon called barium granuloma, and also colon perforation due to pressure of air and barium.